So I'm delighted now to introduce my colleague, Dr. Kathleen Nallen, who's going to give you an update on the RiVeR project. Before I will hand over to Dr. Stephanie O'Keefe to give an opening address for the event. So Kathleen is a midwife by profession and is a lecturer in midwifery and has been the project lead of RiVeR since March 2023. I think it's fair to say that Kathleen is instrumental in the work of RiVeR through her amazing organisational skills and, most importantly, her ability to build networks and build relationships, which is a testament to her. And in fairness, in terms of planning out this event, she has been the main driver in consultation with colleagues from across the school and the institute. So I'm delighted to introduce Kathleen now, who's going to give you an update on the RiVeR project. Thank you, Kathleen.
Thanks, Idel. Good morning, everybody, and thank you very much for coming to join us at today's event. I suppose just before I just get into where we're at with the RiVeR project, just I suppose for those of you who may not be aware, I know most of you probably are, just the background to it. So the background to this is that in 2016 we started to deliver the first accredited education programme in the area of domestic abuse in Ireland. And that's been running here since 2016 and was going well and well evaluated on that. And then really it was on the back of that we put in a submission for funding to the Higher Education Authority, and we were successful in getting funding, and that's where the RiVeR project then came about from there. So what I'm going to do now, as Adele said, is just to give you an update. It's a whistle stop really, it's an overview just where we're at and what the plans are. So, as I said, we got the funding from the Higher Education Authority, and it was known as what's called performance funding. And so it's in recognition of the exemplary contributions that higher education institutes are making to society, the environment and economy at local, national and international levels. So that was the context in which we got it. So we were absolutely privileged and honoured and delighted to have got the funding to be able to make a difference in this area. So we got 833,000 for a 3-year project. And as Adele said, that's what it stands for there, the acronym. So I commenced in post in March 2023. So that's where we're at with it. So just in terms briefly of the governance structure, so there's a steering committee, so Adele and I are on that, and then we have 14 experts with a national profile or a national remit basically, who sit on the steering committee also. And then we have a project management team made up of the 6-7 of us that actually put in the original submission. And they're all here working hard today in all kinds of various roles. And then out of that, then we have 3 working groups that meet regularly. So that's just a slide really of the logos of the those that are represented on the steering committee. And actually, a number of those have been there from the outset, and then obviously others joined us when we started the RiVeR project. So, in terms of what we submitted, quite an ambitious submission. In other words, what we said we would do with the RiVeR project funding. So we had 5 specific objectives. So what I'm going to do is just give you an overview of those. So the first one basically is that we would do an evaluation of the existing programme. So that was carried out earlier on this year. So it involved graduates, the existing students, the students on the programme at the time, the 15 facilitators who teach on the programme. And then we had, this time last year at this event, we had a stakeholder workshop which gave us lots of information in terms of, as Adele said, what were the key areas that we needed to be focusing on, etc. So I'm not going to say any more about that because Lisa Marmion, the research assistant with the project, did all this work, and she's going to present it in the afternoon, so I wouldn't like to give anything away. So on the back of that, so we took all that evaluation, and on the back of that we created a brand new programme. The original programme was a 10-credit programme, but based on the content, and I suppose what was remarkable is all the changes that had occurred since the original programme had started. It was just phenomenal. Even the curriculum document, I think there was 2 pages listed of all the changes that had occurred, not least with legislation, but it was quite remarkable. So the first cohort of that new programme, and that's the title of it there at the top. So we changed the title obviously to reflect, the third national strategy and the language that's being used. So the first group started in September, and lovely to see so many of them actually here today as well. So it's a level 8 programme, 13 weeks, mainly online, but there are 4 days here in DkIT. Actually, interestingly, based on the evaluation, we used to have 3 days. They wanted 4 days because it's really helpful for networking and meeting each other. So the first and last day are in DkIT, and 2 other days as well. As I mentioned, there's 15 facilitators, very dedicated, that have expertise in the area, that teach on the programme, teach and assess on the programme. Something that always comes out of this programme, because of the range of backgrounds, is the very rich peer learning. That's always. And even on the first day, when you ask where people are working or what their background is, it's phenomenal. The rich expertise that's already even coming into the classroom. It has an all-island reach. We have people from Northern Ireland, quite a number as well. And there's a new group starting actually next week, and then we've a master's student who's going to undertake an evaluation of those 2 cohorts, the September cohort and the group that's starting now in January. Actually, there's a nice photograph of the last group. You're very happy with themselves on the first day. So in terms of the kind of profile, it's kind of typical, the kind of profile, but we obviously get lots of others as well. But typically, we get a lot from Garda Síochána, various ranks. And detectives as well, specialist domestic, sexual, gender-based violence services, social work, healthcare, nurses, midwives, public health nurses, a lot from emergency departments, I suppose for fairly obvious reasons, practice nurses, social services, counselling services, and then, as I said, others that work in addiction, maybe in homelessness and those kind of areas as well. And we're lucky enough as well to be able to fund scholarships. We fund 5 scholarships per cohort from the RiVeR project funding, and that came on the back of that evaluation that we did last year here live. Actually, it came back. I think it was 43% said that lack of funding was the reason why they couldn't do our programmes. So we took the opportunity then to offer 5 scholarships, and it's been really successful. So I suppose just something else in terms of ongoing development then. We actually we have committed to developing micro-credentials, small units of study. We hadn't necessarily committed to developing a master's as part of this funding. However, it did come out of that evaluation we did last year, and it's something I get continually asked about or emails about, a master's in the programme. So we did a survey there a couple of months ago, got 144 responses, 67% of who said they'd like to do a master's in this area in DkIT. So we will take up this mantle. We do the micro-credentials first, and then we'll start developing a master's in this area. That is the plan. And of course, obviously, as part of that, then we use funding as well to obviously buy books to stock our library. So in terms of books related to this area, it's well sourced now. Development of an all-island community of practice was another aim, and this is evidence today of you all here that it's developing and expanding. So this is our 2nd conference. We've had other events like Seeking Safety Ireland. We're here one lunchtime. We had an inner shoes workshop ourselves there in June, and we had an event in this room with the students here in DkIT during 16 days of activism, which was really good as well. We have a website. We have a new. It's in the final stages of development. A new website. We have social media presence. We also have a bi-monthly newsletter that we circulate as well. There's just some imagery from our community practice events. So the 3rd objective was to look at research priorities, and that was done through consultation with stakeholders. And we've taken on 2 master students, and they've started in September. And objective number 4 was to develop reusable learning resources, digital resources or resources that can be used for frontline services, people working frontline basically. So there was a collation. Actually, Lisa collated what's going on nationally in terms of education, training, and what resources are available, and that was really helpful to help us identify, where the gaps are. Scripts have been written for 8 short video clips that can be used for domestic sexual gender-based violence education and training, and the stage they're at is that we need now to hire a film production company to finalise those, or to produce them, I suppose, basically. Something else that we're working on with an advisory group is adaptation. So this In Her Shoes, this interactive exercise, it was American-based, so we've got consent from the owners of the trademark to adapt it to In Their Shoes, and also to make it suitable for an Irish-based audience, I suppose, an Irish context. So that's something that we're working on. We hope to have that finished by March, April time, and we'll have another workshop to invite you to then as well. And the plan with that is that we will get it printed. We'll get the toolkits printed, quite big toolkits, and we will then share them at a cost-neutral basis to whoever wants it for their own education and training purposes. So that's the plan for that. Very exciting podcast series is in progress. Lisa and Mohammed are busy doing recordings. I think there's 6 in the can. And there's another 4 lined up over the next few weeks. This is really exciting. So this is podcasts. We're doing video podcasts and audio podcasts with experts in the area. And the 6 I've heard so far are just absolutely fantastic. So really excited about that. We're working with the marketing communication department here, so we'll have a launch of those maybe around April time. That's the plan at the moment. That's to be finalised. So we'll let you know when they are released. They'll be available on all the usual sites. And one of the master students, actually Esther, is also working on developing RLOs for frontline services. And we're also working on developing micro-credentials, and as Edel mentioned earlier, what came out in the word cloud when we did it here last year, what shone out, we asked what areas, like in terms of micro-credentials, these small units of accredited study, coercive control. So we're working on the coercive control one. There'll also be one in relation to the child, but just the details of that we just haven't worked through yet. So that's something we're working on for this semester. And then for this particular specific objective, we hired an educational technologist who started in April. Lisa's down there flashing red cards at me, imagine. We did tell her to be ruthless, in fairness, so I better get off the stage. So the last specific objective is to develop resources for the higher education sector nationally. And so a lot of you probably know that the HSE have online modules in their HSE Land platform on awareness, recognise, respond, refer. So this probably is what we would be doing if we were starting from scratch, but they kindly offer to collaborate with us. So collaborations are ongoing with them. And then the plan is that we will share them, and we can adapt them if we wish, and we will, because they're obviously health focused, and then we will do an evaluation of them as well. Okay, so I didn't do too bad, Lisa. I'm nearly there. There's just some further information, and I'm happy to take any questions later on. I'll meet you, mingling during the day and whatever, and you can always email or contact me as well. So, thank you very much.